how people develop phobia, the theories would depend on what your psychological background is. If you're a Freudian, you would believe that there's some psychological, probably sexual significance in the phobias you choose to have. If you're a theoretical psychologist, you might assume it's from something traumatic that happened to you in your childhood or in your early adulthood before you develop the phobias. But we really don't know. We really don't know. We're learning more and more about the genetics of a lot of our psychiatric disorders, that maybe there is a genetic component. But what most of us think is the genetic component is not the determinant of whether you will or won't develop these disorders. Rather, it is something that puts you at greater risk of developing the disorders given a certain set of life circumstances, or perhaps the genes we inherit give us a greater resilience against developing the disorders if the same things happen. We really don't know yet. We know that when certain things are involved, when we get to a certain point in these disorders, there are clear biologic, chemical changes that occur in the brain. But you know, if you get embarrassed, you get flushed in the face. Now, nobody in the right mind would say the reason you get flushed is because there's a chemical imbalance in your brain. The reason you get flushed is you get embarrassed. It's something somebody does or says or something that happens to you. But the way it works in practical terms is there are changes that go on in the brain that causes the blood vessels under the skin to dilate, and that's why we get flushed. So in a lot of our disorders, there are biochemical changes that occur to make the symptoms manifest themselves. But once the disorder gets going, it is likely that there are actual changes in brain functioning, which may be what keeps the disorder going once the initial stressor might long since have left.